Good evening, North Brunswick. This is Janet Chiroka. I am the acting superintendent here in North Brunswick Township Schools, and we are very happy to welcome you here to our Return to School community meeting. I am happy to have joining me tonight, Amy Rumbo, our assistant superintendent.
Hi.
Mary Ellen Engel, our nursing supervisor, K through 12, and Mercy Chang, our director of accountability and special programs. We appreciate your taking the time this evening or whenever this is convenient to you to watch this video following our posting it on our website to gather more information and find out some answers to questions that you may have about our return to school for 2021. We know there are quite a lot of questions out there these days, and very understandably. And we decided that a community meeting in a live stream would be the best way to provide you with the answers to those questions. We opened up a Google form for you to put in your questions, and we appreciate all those people who submitted questions to us. And sort of as we thought, there would be a lot of repeat questions. So we were able to put them into buckets, and hopefully we will address all of them here tonight. If you do not find your question answered, we will be putting FAQs on our website, trying to answer the specific questions again in more detail. Additionally, your principals at your children's schools will also be able to answer those questions, or perhaps the school nurses or other people in other departments. We are here to help provide you with the answers and make sure that our return to school is as smooth and seamless as we can. So to start off with, we will discuss some I apologize for this. My screen is not moving. Present here. Are you guys seeing it move?
No.
There you go. Okay, beautiful. All right, so a couple of basic questions that were asked were things that we think most people would know the answers to, but we want to just make sure that we answer those basic questions for this year. So unlike many years, our first day of school is prior to Labor Day, because Labor Day is quite late this year, and the calendar was set a good time ago by the Board of Education in the previous school year, and some negotiations were made with the NBTEA to bring school back and start school prior to Labor Day to get our students in earlier, and especially so our AP students can get more time in the classroom prior to their AP exams. So September 1 is the first day of school. It is a full day. September 1st, 2nd, and 3rd, the Wednesday, Thursday, and Friday of that first week are all full days of school. For those parents looking to find out information on their child's bus, Mr. Keener, the transportation director, has began mailing bus passes to parents. So they've been doing a few bus passes each day, and those are in the mail to you and on their way via snail mail. Before and after care is being provided for pre-K through 6 through both the LEAL program provided by the township for grades 2 through 4, and for grades preschool, K and 1, through the program Right at School. There is information on our website about that. The Genesis Parent Portal will open on Thursday, August 26th at 4 p.m. and parents can there log on there to get information on their child's homeroom, their class schedules, and such. But also use our district website to find school start times for regular days, early closing days, delayed openings, and so on. And other vital information is all there on that website at NBTSchools.org. It really is a great one-stop shop for you to find information. So many people were wondering, why were we doing a community meeting and not doing like we did last year? We did Zoom meetings at each school. So with our information coming so late from the governor about some changes, and us waiting to find that information out, our principals are running orientations at their buildings and are inviting in pre-K, K and 1 new K students and first grade students who have not been in the building to come on Tuesday, August 31st at 2 o'clock. Our high school has been running orientations for new students as well. They are running one this evening, and this is also why we're running this as a YouTube, so people can watch this again if they're having to go to their freshman orientation tonight. NBTMS and Linwood have also been running their orientations. So we didn't want to have the principals each have to do another community meeting. We felt that we could provide a great format here and give you the information that you needed in this one live stream event. So some more back to school basics for you. So as per Governor Murphy, schools must offer a full day of in-person instruction with no virtual option, as we did last year. This does not include quarantine instruction, and we will talk about that a little later, and they must serve lunch. We must socially distance to the greatest extent possible. I know that is a concern for parents, especially with the Delta variant here, but with the guidelines from the governor, we will do our best to socially distance to the greatest extent possible and continue our layer strategies to make sure that every child is kept as safe as they possibly can. More back to school basics. Lunch. We did get the grant from the federal government and Chartwell's, working with Chartwell's, that lunch will be available and free to all. I know many parents are concerned about lunch as a time that COVID could spread, and we certainly understand that. We are working with our principals to provide as safe an opportunity in lunch as possible and limit the time that students are maskless while they're eating. They will have assigned seats, and depending on the grade level, they will be maybe by their homeroom or their classroom. At the high school, they'll have a QR code that they'll be able to scan in to identify their seat. Breakfast is also going to be available to all students at no charge. They will be sending a survey to parents for parents to opt into breakfast, which will be delivered to the classroom. But we are waiting to see and trying to limit that time where students are maskless. So we may, as the fall goes on and we see how things are going, we may adjust that policy or that procedure. Please reach out to your school nurse if there's a medical necessity for your child to have a regular snack based on a medical issue. And we will certainly work with those accommodations as necessary. Lockers. There will be no sharing of lockers and no loitering at lockers, but students in Linwood, NBTMS, and at the high school will most likely be using their lockers. They will not be using gym lockers or changing for gym. Drinking fountains will not be available for drinking, but we have a lot of fountains in the district that are water filling stations. So students may use their refillable water bottles at those water filler stations, and students may bring those refillable water bottles and certainly can have a drink of water in class, lift up their mask, take a drink, and stay hydrated. Emergency drills must be completed as per the guidance from the New Jersey Department of Education, and we will continue those drills. Athletics. For our athletes who are 12 and above, we highly recommend the vaccine. As you'll hear later with other quarantine guidelines, vaccinated students and athletes will not need to quarantine if they are exposed to a COVID positive case and remain non-symptomatic. So again, in athletics, there's also no changing for gym class. Extracurricular activities, we want to continue to try and bring back as many opportunities for our students to participate in clubs and extracurricular activities, maintaining the safe protocols that we have put in place, and hope to have competitive events held off campus that our students can participate in. Field trips will be very limited, only competitive events. And then we will begin looking hopefully in the new year to begin expanding our field trips again to our students. Ms. Rumbo, did you want to address this next slide for us?
Thank you, Mrs. Stroka. Again, with this school year and this road forward, as the state of New Jersey calls it, and this return to school, at the forefront is health and safety, and our commitment, our Board of Education's commitment to all who enter our school buildings. And we will continue to prioritize the health and safety of all of our students, all of our staff. And these are just, some of our commitment statements to all. We will continue, as we have done since the pandemic first began, to monitor the CDC, the Center for Disease Control and Prevention's guidance. We are continually monitoring their guidance also not only for schools, but childcare programs, and of course, monitoring information that is disseminated from the state, from Middlesex County, from local health departments, aside from the county in our community as well. We are continuously maintaining communication with state officials, county officials, local authorities, health departments, and determining current mitigation levels in the community. Again, the district acting superintendent, Mrs. Shiroka, and our supervisor of nursing here tonight, Mrs. Mary Ellen Engel, are our primary liaisons. And we are in continual meetings, phone calls, conferences, with all of these individuals in order to get the best information and the fastest type of information to all of you as our stakeholders in our schools and in our community. Again, first and foremost, we are continually promoting healthy habits and behaviors, obviously to reduce the spread of COVID-19, but these are healthy behaviors, some of them that should be continuing on regardless. Again, in order to reduce the spread of COVID-19, we are wearing masks in schools. That has also been mandated from Governor Murphy. Earlier this month, the wearing of masks of all personnel and students in public schools. We are encouraging our students and staff at all times to remain home when ill, whether it's presenting with COVID-19 symptoms and self-reporting or otherwise. Stay home, rest, get healthy to return to school. We are encouraging our students and staff, as I just said, to self-report symptoms of COVID-19. We are continually to encourage proper hygiene practices, particularly hand washing, hand sanitizing, as Mrs. Shiroka mentioned earlier, social distancing measures to the greatest extent possible, and respiratory etiquette. We are also encouraging everyone to talk to their healthcare provider about the COVID-19 vaccine and to reach out to our nurses. We have a very robust virtual health office as well, online through Mrs. Engel and our nursing staff here that have opened that platform up to the community. And it's really been a great piece of our movement and our health and safety commitment here in our district. We wanted to report to you, and some questions did come in, but we wanted to report to you some serious and relevant statistics about where we stand in North Brunswick and in North Brunswick school system. We are about 97% of our staff are vaccinated, have received either the full Johnson & Johnson one shot or at least one of the other two, Moderna or Pfizer, the 2-shot vaccine. 74% of community residents here in town have reported that they are also fully vaccinated. We also are looking at we're looking at 1,071 of our students, 12 and up, who are fully vaccinated, and 191 who have received one of the 2 shots for the Pfizer vaccine that's available for children 12 and up. So approximately we're starting to circle around 1,300 of our students in our school district are going to be fully vaccinated. These are outstanding numbers. We feel very confident that those numbers will continue to go up, but that also our mitigation strategies are really going to help reduce the spread of COVID-19 in our school district. And with that, this is the perfect time to introduce. We've introduced her many of times last year at our meetings. Our district supervisor of nursing, Mrs. Mary Ellen Engel, who's here to talk more about that health and safety commitment and that focus on wellness in our school system.
Hello, thank you. I'm happy to be here tonight to share very important health information that will keep our school community safe. So the most important thing I want to talk to you about right now is that we know that our children who are healthy and feel safe learn best. So our commitment is to reach that potential, the highest level of health that we can for our children. North Brunswick is utilizing a child-centered model. It's called the whole school, whole community, whole child model. and it's focused on creating a safe and healthy environment for learning. The whole community, whole school, whole child model is a framework that serves to align the common goals of home and school and community. Check out our new health and wellness page on NBTSchools.org and our website, and you can click on the different areas that we're going to be talking about. So you're going to look for the Health and Wellness Office. The WISC model, which is the shortened name for the whole school, whole community, whole child model, is student-centered, and it emphasizes the role of the family and community in supporting school, in the connections between health and academic achievement, and the importance of evidence-based school policies and practices. The WISC model has 10 components: physical education and physical safety, nutrition environment services, health education, social and emotional climate, physical environment, health services, counseling, psychological and social services, employee wellness, community involvement, and family engagement. And I invite you to explore each component on our website, and we'll be updating this information frequently for your information. And next slide, please. So we are all depending on each other to make the best health decisions for our students and our community. North Brunswick Township Schools, as we said, is utilizing a layered prevention strategy approach to mitigating or slowing the spread of COVID-19. Vaccination is the leading public health prevention strategy to end the COVID-19 pandemic. We encourage everyone who is eligible for the COVID-19 vaccine to get vaccinated. Everyone 12 years and up is eligible for the vaccination. The vaccination is FDA authorized, and it is approved, and it is safe and highly effective in preventing severe illness, hospitalization, and death due to COVID. And it remains the leading way to protect our children, our families, and our community. Vaccines are free for everyone. Your immigration status will not be asked, and insurance is not required. We really encourage parents to consider having their child tested if they are not vaccinated before we return to school. And we rely on parents to really carefully review their child's health every single day in order to return to school. So this last year we used a form that parents completed and reviewed and signed to attest that they would review each child's their child's health. And this year we're asking you to do that again at home every single day. Parents and caregivers should monitor their child for signs of illness every morning before leaving for school. You are the front lines in assessing your child's illnesses. We need you, and we're depending on you to keep children who are sick at home. This is not the time to tell your children to try and tough it out for a few hours and see how you feel. We will be very, very strict in following the exclusion criteria that has been given to us from the Department of Health. So now the question is, what are the rules and what should I be looking for? So the New Jersey Department of Health guidance states that children with the following symptoms should be isolated from others and should not attend school. If your child has 2 of the following symptoms, they should remain home: fever or feverish, chills, muscle aches, headache, sore throat, nausea or vomiting, fatigue, congestion, or runny nose. Or if your child has 1 of the following symptoms, they should also remain home. The symptoms are cough, shortness of breath, difficulty breathing, or loss of taste or smell. Keep your child home and report your child's absence to the attendance line at your school. And if you have specific questions for the school nurse, please send an email and the nurse will respond promptly.
And Ms. Engel, can I interrupt for a second? All this information is also on the school nurse websites, right? On your nurse.
Exactly. Yes, I was going to say all the information and the symptoms and the daily assessment that you should do will all be available for you to review. Yes. Okay. How will your child be able to return to school after it's determined that they are excluded? Your child will require a COVID-19 PCR test and be feeling well in order to return to school. Now, this also will depend on the information that you'll receive from the school nurse because she will call to discuss the specifics of your situation and discuss the next steps. If your child becomes ill at school, you will need to be able to come to pick up your child within 30 minutes. So be sure that you log on to the parent portal and update your information, your demographics, your phone numbers, and your people that you are giving permission to pick up your children in case we do need to contact you. And if your child does develop COVID symptoms, we will be following the New Jersey Department of Health guidelines, and they will be placed in an isolation area with a staff member who will monitor them until the time of pickup. Another important component of the layered prevention strategies that North Brunswick is using is mask wearing, which we've discussed, but I would like to talk about it again. The mask must be fit appropriately, covering your nose and your chin, over your chin, and fit snugly. Okay, if you send your child to school with a disposable mask, they need a new disposable mask every single day. And for cloth masks, also the same. They need to fit over your nose and your chin securely and comfortably. And if you decide to send your child to school with a cloth mask, it should be a clean mask every single day. I highly recommend taking an extra mask or two and placing them in a plastic bag and putting them in your child's backpack in case the mask that they were using becomes soiled. We will have extra masks available if needed, but many times from our experience last year, we understand that children like to wear the masks that they bring from home. Okay. Okay, other mitigation strategies that we want to encourage and we want to make sure you're aware of. We spoke about hand hygiene. That's embedded into our day. We are going to be teaching hand washing. We'll be doing it whenever it's appropriate, whenever a child needs their hands washed. We'll be using also hand sanitizer. We will be minimizing shared equipment whenever possible. And we will also be maintaining distance to the greatest extent possible also. School nurses will continue to follow the guidelines from the New Jersey Department of Health and complete contact tracing. Contact tracing is a strategy that is used to determine the source of an infection and how it's spreading. It is labor intensive, so nurses spend a lot of time calling people, asking questions, informing parents and others about their potential, if they were potentially had an exposure. So finding these people who are the close contacts is really important. So we hope that you will answer the call, that if it's one's made to your home, and that you do your very best to answer the questions thoroughly so that we can hopefully minimize any chances of spread. We discuss close contacts, and a close contact is defined as someone within 6 feet of someone with suspected or known COVID-19 for 15 minutes or more during a 24-hour period. So one exception that was made recently in the new guidance is for schools, and in the indoor classroom setting, the close contact definition excludes students who are within 3 to 6 feet of an infected student who is laboratory confirmed or clinically compatible symptoms, where both the infected student and the exposed student are correctly and consistently wearing well-fitted masks the entire time. Now, I know that's a lot, but that is something that we will be evaluating very closely in the health offices, the school nurses. That will be their primary responsibility to determine if someone was a close contact. And this only applies to children. It does not apply to adults. But in the event that we have difficulty determining whether or not an individual was a close contact, we always, determine that, we always do the safest thing and determine what the cohort is, and potentially we would consider everyone exposed. So that's why it's really important to encourage your children to wear their masks consistently and the correct way when they're indoors, so that we can really minimize the chance that we would have to exclude the child. Then one other important message I want from the school nurses is that it's really important that you report any health concerns, especially new health concerns, new health issues your child may have. You can complete a health record update for your child. It will be available on the parent portal when you log in. And if you fill that out, the school nurse can review that and will reach out to you to review the new information and make sure that we are able to care for your child safely. Be sure that you include any new medication that's required at school or any new treatments that might be required at school. The message we want to give you is that we are really working hard. The school nurses especially, we're collaborating with our staff, with our families, with health departments, with other physicians. We want to ensure that we continue to provide evidence-based, clinically competent care for your children. So we look forward to partnering with you and a successful and healthy school year. And now we have a brief message from our school physician, Dr. Bert Mandelbaum.
It's about 10 minutes, right, Mary Ellen?
Yeah, or less.
Or less. So I'm going to play this. And for those of you who may not yet know Dr. Mandelbaum, he is a pediatric physician who works out of Princeton Nassau Pediatrics, and has just been an invaluable partner to us in the district over the last year. Very sensible and practical advice, and coming at it from the lens of a person who works day to day with children in his pediatric office. So let me put his on the screen and I will enlarge it for everybody to see.
Good afternoon, North Brunswick community. My name is Bert Mandelbaum, and I am here today to give a brief update on safety plans for return to school in the era of COVID-19. So it is Saturday, August 21st, just so we know what day we're talking about, because things are changing rather rapidly. For those of you who don't know me, I am a practicing pediatrician at Princeton Nassau Pediatrics. I am also a consulting school physician for multiple townships, including North Brunswick, and I am the chair of pediatrics at Penn Medicine Princeton Health, and over the last 18 months have served on their COVID-19 task force. So this will be brief, and I will do my best to try to give you a sense of all the hard work that the North Brunswick administration has been doing, what their plans are, and so there is some transparency and understanding of what to expect once we return to school. So to start, the Delta variant was a game changer come July, and this is just a new mutation to the existing circulating virus. So we know viruses mutate every time they replicate in the body. They have an opportunity to make a mistake in that replication, and that's called a mutation. And sometimes those mutations are totally harmless, and sometimes they allow the virus an advantage. What we think happened with this mutation is that this virus now has the advantage that in order to bind into cells, this mutation allows it to bind a little bit more effectively. So what that means is if you're exposed to the virus, if it could bind to the receptor and get into the cell a little easier, there is a better chance that if you're exposed, you'll get infected than in the past with earlier variants. Once it's in the cell, it's because there's more virus in the cell, the virus then makes copies of itself, and that then enables there to be more copies of the virus in your body. So when they're talking about higher viral loads, that's what they mean. So higher viral loads means you're shedding more virus, and this virus is then more contagious, easier to spread. And that's what we're seeing. We're seeing it going through the community rather quickly. What it really means, we think, is that there is a really high likelihood that if we don't practice mitigation strategies, so trying to prevent COVID-19 or to getting infected by COVID-19 and or getting vaccinated, there's a really high likelihood that people will ultimately come down with this COVID-19 and this Delta variant. The debate is out, we're still debating whether or not this variant is a more serious variant in terms of the disease it causes. We're not positive about that, but we are positive that it is causing more disease. So you're getting more people who are getting sick just because there are more people who are getting infected. What's nice is that the disease, this virus is spread similarly to what was happening with the prior viruses or the prior variants. So the strategies that we used in school will still work. Masks, physical distancing, staying home if you're sick. And now we have the ability to vaccinate. And we know these vaccinations are working. And despite what you're hearing about there being vaccine breakthroughs, which are definitely happening, very few things are 100% perfect. But we're actually seeing, as more people are getting sick, the benefit of the vaccine is even more easy to spot, because the difference between the chances of getting sick before, when there wasn't that much virus, to now, if you're not vaccinated versus vaccinated, we're generally assuming that allowing this to spread long enough, if you are, especially if you're an adult, if you're unvaccinated, there's a really good chance that you'll end up getting the Delta variant. And if you're vaccinated, there's a very good chance that you won't end up getting it. So with that, we're obviously encouraging everyone who can, 12 and up, to get the vaccine. So let's talk about the safety plans. So the mitigation strategies, as I said, that the school will employ are basically the same as last year. As much as they can, they'll try to make sure that there is distancing between students in school. They will try to make sure whenever they can that kids will be facing in one direction, so they're not trying to face each other. They will be, as it is a New Jersey mandate, everyone in school will be wearing masks, so that will help to decrease the spread. We will still continue to tell parents that they will have to do daily screening on their own of their children, and if they are sick, they shouldn't come to school. They'll need to be evaluated and cleared to come in to show that they don't have COVID-19. If you find out that your child is quarantined, you'll have to keep them home, and the school will be doing contact tracing. What is nice is that we expect the rules this year to be, the CDC has advised that if students are 3 feet or more apart and they are wearing masks and they are exposed, you do not have to quarantine them. So in the contact tracing process, that will hopefully result in less students being quarantined. The schools, we are going to have lunches because it will be a full day of school. So that means that the schools will have to figure out how to do lunch as safely as possible. It is unlikely that they will be able to get kids 6 feet apart during the lunch hour, and kids have to have their masks off to eat. So they're going to have to just use some strategies and at least know where students are sitting, do the best they can to, again, get as much space as possible. And this is what the school has been working on all summer. What can parents do to help this? So the first thing the parents could do is, if you have not gotten vaccinated, please consider doing so. There is a ton of data about the vaccine, and the vaccine and the safety data really seems to be reassuring. We know that there is a risk benefit to everything, but there is a risk to not getting the vaccine and getting the disease. And we really feel like that risk significantly outweighs any risks associated with getting the vaccine. So we're encouraging all adults to get the vaccine and all children right now, 12 and up, to get the vaccine. New Jersey has actually done a great job with this. So we're approaching a really high percentage of adults that are vaccinated, and we are getting closer and closer to having as many 12 and up kids vaccinated as possible. But there is still time. If you are considering getting vaccinated, please go ahead and do so. There will be some benefits to being vaccinated, specifically, per the CDC rules, because vaccinated people, both students, staff, and adults, but in the school setting, vaccinated students and staff, if they're exposed, they do not need to quarantine. So we know people who are vaccinated might get a breakthrough infection. So we still say you have to watch yourself. We recommend that they get tested. But if a student was sitting next to someone at lunch or in their class, and the student next to them had COVID, when we do contact tracing, vaccinated students and staff do not need to quarantine. They can still come to school as long as they are asymptomatic. So that is a huge advantage to helping to keep kids in school and keep kids in extracurricular activities, including sports. So we're encouraging all of our kids who are playing sports or in marching band or other extracurricular activities. It has been so long since they've been able to kind of have a full season. The more they are vaccinated, the better the chances are that we will not have to quarantine them or, God forbid, isolate them, which is what we have to do. If they get sick, they have to stay home for 10 days. Please also remember the travel guidelines. So although New Jersey got rid of its own specific travel guidelines, it had always defaulted to saying, let's follow the CDC guidelines, of which the CDC says that unvaccinated people who travel need to quarantine and stay home. And the school will be abiding by those CDC guidelines. So if you have travel plans and you're a student or you're a faculty member and you're not vaccinated, please make sure to keep that in mind before the beginning of school, because there is a minimum of a 7-day quarantine with a test or a 10-day total quarantine. So those are the basic plans. We will have masks per New Jersey guidelines. They will do as much physical spacing as possible. And the school will continue to work to try to do its best job to balance having everyone in school for a full day, keeping them in school and making it safe, making sure that school is, that the education is appropriate, and working on the whole child, both the physical and mental health of the child. I think the district, the faculty, they all seem very excited to get kids back to school. And man, I have been looking forward to this. So please stay safe. If you have an opportunity to get vaccinated, get vaccinated. Get excited for our return to school and stay posted for new news as we move towards our first day of school. Thank you and talk soon.
So obviously, Dr. Mandelbaum provides a great support to us as a district, great information. Oh, it's trying to run again. I have to escape for a second. There we go. Go back to the next slide.
Good afternoon.
There we go. All right, got that moving forward. Okay, Ms. Rumbo, I believe you are up on quarantine instruction.
The slides aren't showing yet, Mrs. Shiroka, so I didn't know. I mean, I'm fine to read them, but.
Zoom shared, there we go. New one. We'll stop it for a second and reboot it so you get to see all of our lovely faces, and it may look different on the YouTube. Let me try again. Okay, can you see that now? Ms. Rumbo?
Yes.
Beautiful.
So I'm here to discuss, along with our colleague, our Director of Accountability and Special Programs, Ms. Mercy Chang. We're going to talk again. I'm going to repeat some of what Dr. Mandelbaum closed out with, which is the quarantine guidelines. We can go to the next slide, Mrs. Shiroka. We will be providing this infographic in our own comprehensive plan that we will be publishing to our website at the end of the week. The quarantine guidance that Dr. Mandelbaum just spoke about, that students, staff who do test positive have to remain excluded for 10 days. That has been, the guidance, and that is the guidance that we must continue to follow. And again, while we are working hard to mitigate the spread of COVID-19 and using a layered mitigation approach strategy, we do realize that there's going to be times when students and staff may need to quarantine. Unlike last school year, with the introduction of the COVID-19 vaccine, we definitely will see less disruption to that in-person school day, as evident by the numbers that I was able to provide for you, a short time ago. But again, we're looking at vaccinated, the quarantine guidelines, and then for those who are unvaccinated. In fact, and again, Dr. Mandelbaum was able to record that for us just the other day, and just 24 hours ago, Governor Murphy did state the requirement that all school staff employees will have to provide proof of vaccination by October 18th, or then will have to be required to take weekly COVID tests and provide that to the district. So again, if you're vaccinated, after exposure, you do not need to quarantine. And that also goes for travel, as Dr. Mandelbaum also just talked about. And when we're talking, when we're looking at, and we know that there are people and students, obviously under 12, that cannot be vaccinated yet. So we are putting plans in place, and Mrs. Chang's going to talk about them in a few moments, for unvaccinated people. And after exposure, that they are going to have to quarantine, and also going to have to quarantine after travel as well. And again, just to remind everybody, what it means to be fully vaccinated is 2 weeks after the second dose of the Moderna or Pfizer vaccine, or 2 weeks after the single dose of the Johnson & Johnson vaccine. We go to the next slide, Mrs. Shiroka. Great. So again, as we mentioned at the beginning of our presentation, in accordance with the governor's orders, there will not be a remote option. He announced this in late June, which then negates what the executive order of last year was, where he provided the alternative to in-person attendance. So again, there will not be a remote option. However, we will discuss with you the quarantine instruction that will be provided for those students who need to quarantine. Again, the district in its commitment, we do this regardless, but we want to again remind our families that we will continue to ensure that those additional supports are provided to all our students, in particular those that are our English second language learners, those with 504 plans, those with individualized educational plans as well. And then again, in addition to those mitigation strategies, we're going to, and that's part of this whole health and wellness commitment that we have in district, is to protect students and their education, their physical health, and continually consider and monitor the impact of social emotional needs of both our students and our staff. We have partnered, again, we have guidance counselors in all of our buildings, and we've made partnerships throughout our communities, even prior to COVID, that we're continuing, such as, UBHC, which is partnered with Rutgers University Behavioral Health Care. This has been part of our plan to meet social emotional needs of our students. And again, now more than ever, we're continuing those partnerships, in order to, again, focus on not just the physical health of our students and staff, but their mental health and wellness as well. And that's just as important as we continue this road forward to open our schools in a week and, go back to full day in-person instruction. And speaking of instruction, we have Mercy Chang, our Director of Accountability and Special Programs, here with us tonight to talk about district plans, again, for providing instruction during quarantine. Ms. Chang?
Thank you, Ms. Rumbo. Hello, everyone. Thank you for joining our Return to School community meeting. As you can see, we have been very busy preparing to welcome back our students, who we really look forward to seeing in person. And our main goal, frankly, is to keep students in school physically for as long as possible. That being said, as Mrs. Engel and Dr. Mandelbaum stated, we are working hard to mitigate exposure to COVID-19, but we realize that there will be times where students will need to quarantine or isolate due to exposure to a COVID-19 positive individual or due to being symptomatic. When this happens, our district has worked really hard with subcommittees to determine what does instruction look like for students who are learning from home. And we want to, of course, acknowledge that instruction from home or learning from home is definitely not our first choice, and being in school is more effective and preferred. But we are dealing with a pandemic, and we will do our very best to maintain the continuity of instruction if a child needs to quarantine. So here is our plan. Students who are quarantining or isolating will engage in asynchronous learning at home. The learning will be meaningful and prepared in advance by their classroom teacher or at the high school by subject-specific teachers. Assignments will definitely be in line with the curriculum that's being taught in the classroom, meaning these are not generic assignments. We're not just throwing up, read for 20 minutes or go on this website. Students will continue their learning and stay on pace with curriculum so that when they return, they can jump right back in. Next slide, please. Ooh, we're missing a slide. I think you're not, yeah.
Here we
There
go.
you go.
Here we go.
There you go. As Ms. Rumbo stated, we are definitely concerned and aware that children need to be in school physically, not just for their learning, but also for their emotional well-being. And so to kind of bridge the academic needs of our students and their emotional needs while they're quarantining, we've created a little program that we're going to call Coach and Connect. So while the assignments will mainly be asynchronous, all children who are quarantining will have the opportunity to meet live virtually with a certified teacher for support. It's going to look a little bit different at each level, so let me outline that for you. But the most important thing that you need to know is that they'll have extended time with an adult who can assist them with their work, reteach, or explain a concept that they may have been working on independently that they were struggling with. We'll go on to the next slide. So given our staff and our students and their various needs at each level, it looks a little bit different. At the high school, students will engage in their asynchronous work by department, by subject, but at various times throughout the day, there will be a teacher available per department to provide a check-in, a live check-in. This is a time for your students to jump on and say, I'm struggling with this concept. I need somebody to explain this to me, or honestly, to just say like, I'm just feeling a little sad today that I'm home quarantining. Either or of those reasons are good reasons to jump on to Coach and Connect. All sessions will occur during the day except for math sessions, which will occur at the end of the day. At Linwood and the middle school, we will have live check-ins for both language arts and math by grade level. So if your child is a 5th grader who is quarantining, they can jump onto a live session with an ELA teacher, and at a different time also jump onto a live session with a math teacher. This will give them a good chunk of time where they are actually interacting with an adult, even though they were completing some independent asynchronous work. And at the preschool and elementary schools, similarly, we'll have one certified teacher per grade level available to provide live check-in times. This person will be able to assist children in navigating assignments or re-explaining or reinforcing concepts as needed. Our hope is that through the Coach and Connect model, we can provide students with the attention that they need while also maintaining, really the continuity of instruction for the in-person students. You may wonder, why can't my child just jump on live while the other kids are in school? And, through our 1 year of experience, we found that that was quite disruptive in a lot of cases. Sometimes our bandwidth really couldn't handle that many people on the internet at once, and very difficult for the teacher to navigate providing attention to the in-person students and the at-home students. This is our best compromise right now, but we will always continue to monitor our plans and adapt them as necessary. Hopefully, quarantining will be minimal. Please keep your children home if they're sick, and that will help minimize quarantining. And we'll do our very best on our end to keep them safe as well. That is all of the instruction during quarantine. If this happens to you, you will get very detailed information about next steps for your child during their quarantine period.
Right. And as Ms. Engel said, Mrs. Chang, if a child is sick, we want them to not be engaged in their schoolwork. We actually want them to work on getting well, right? So that this will not be available for somebody if they just have strep throat or, a stomach bug or something like that. We want them to be out sick and rest and get well so they can return to school. But this is available for students who are needing to quarantine because of being exposed to a COVID case, correct? Next slide. Thank you, Mrs. Chang.
Sure.
All right, facilities. I wanted to give you some update on facilities and some information. Obviously, we've already talked a lot about cleaning protocols. Last year, the district invested in having an outside company come in and do an evaluation and an audit of all of our buildings, our cleaning protocols, our systems, and we came out of that with great flying colors, some recommendations which we had implemented last year in terms of monitoring our cleaning and having lists and a sign up sheet outside every room in terms of cleaning and protocols there, in terms of bathrooms and so on. HVAC is often something that's talked about in terms of COVID-19 and the importance of having good airflow. Our facilities and buildings and grounds team work very hard to make sure that our buildings HVAC systems are up and running properly, that we are changing our filters regularly. We run our HVAC with the maximum required amount of fresh air coming in from outside. So that's why you don't see our building windows open, because the fresh air is being circulated from inside to outside and inside to outside continually throughout the day. Some people did ask about barriers and dividers in classrooms. We actually chose not to invest our money in those last year. And very interestingly, I shared an article with Ms. Engel. Just the other day, I was reading an article with some research findings that actually that air was getting stuck in certain areas in classrooms and not properly flowing throughout an entire classroom, and was actually not a positive thing having those barriers in the classroom as towards mitigating COVID-19. So you will not find us with barriers in our classrooms, but the classroom desks will be facing forward and students will be wearing their masks and continuing cleaning things and keeping to our protocols. In terms of transportation, again, as has been mentioned before, masks are required on the bus, and your student will need to be prepared and have the mask ready and be wearing it as they board the bus. The bus drivers will have a mask for a student if it is forgotten, but we do ask parents that they make sure that their child does come to the bus with a mask. We cannot guarantee social distancing on our buses, so that is something to be aware of. If your child is in the elementary school, you will see that you have pre-K through 4 students on the same bus. So if your preschool student is at LP or Parsons or Judd or JA, they would be on the bus with the other students in the same elementary school that are on that bus route. And they will not have, this is acceptable by the New Jersey law that the students may be transported. The bus seats do have seat belts. So we would recommend that if you have a young child that you are going to have riding on the bus, that you do practice with them putting on and off their seat belt. NBTSchools, our early childhood center that we're going to be wonderfully opening up next week for our first students, that's been renovated and we're moving out of Milltown. They will have dedicated buses just for their early childhood children because that's all who are there. Parents certainly do have that option. If you are not comfortable with your child being on the bus, you certainly do have that option to drive your student to school. Masks, and again, this is an important concept. We know it is something controversial for many people. However, the guidelines from the governor are clear. So indoor mask guidance, including school buses, is for all students and employees shall wear masks at all times, except for individuals who would not be able to remove a mask without assistance, individuals with medical conditions or disabilities as reflected in federal disability laws that preclude the use of a mask, and when wearing a mask would be considered unsafe. Protocols for seeking medical clearance when wearing a mask. There is an exemption mask form that can be found through the school nurses on the website, correct, Mary Ellen? And it must be signed and stamped from the student or staff member's primary physician requesting that student or staff attend school without a mask. Physical distancing indoors shall be maintained to the maximum permitted in any occupied space. It is not required outdoors, and masks are not required of any individual while outdoors. Our principals will also be sharing with you guidelines for mask wearing, for refusals of students to wear a mask. They have created an outline for parents to see, which they will share out on discipline protocols if students continue to refuse to wear masks. Students who will not, if they forget a mask, they'll be provided a mask. And if it's a refusal, however, they will be asked to go home until they will wear their mask. And we will work with families to come to accommodation to make sure that we can get all our students in and avoid a battle. It is a state mandated law, and it's not a law, but an executive order by the governor. And it is very important that we follow those to keep all of our students safe, especially in this time when there are those uncertainties. I know we were all hoping, as a vaccinated person myself, I was just thrilled to be able to take my mask off and go places without that mask and see people's smiles. But right now, spread is high in our community, and it's really important for us to make sure that, we're erring on that side of caution. We are responsible for over 6,000 students and their health and safety. So it is really important that we all work together and make sure that we are masking up, regardless of our personal preferences. So we want to thank you for joining us this evening. We know it's been a long presentation, and we hope you'll find this is a resource that you can use in the future. We are continuing to place these resources that we've been referring to on our website for you. So you can watch this at your preference, at your whatever time works for you. Our comprehensive district NBTSchools Road Forward plan, which integrates the state plan, will be posted to our website by the end of this week. And that's a great place for you to go and see these written procedures that we are following as a district. We will also publish a list of our answers to your questions that you posted on our Google form, and we appreciate you sharing out those questions with us. And we will consolidate them and have an FAQ to you by next week with answers to those questions again on our Return to School site. So once again, we thank you for joining us this evening. We hope we've provided you with those answers. If you still have questions and things you were unsure about, again, our staff, our principals, our central office staff is here to support you and help guide you to those answers, and hopefully provide friendly customer service to you. And as you see, Mr. Keener, our energy savings is kicking in, and my light has just gone out, so I apologize for the darkness, but our energy savings plan does kick off our lights if we stop moving a certain amount of time. So ladies, thank you so much for joining us this evening. We appreciate your time, and we look forward to seeing all of our students back in person next week as we return to school, and wishing you all a healthy and safe return to school this next year. Thank you so much.